Jag är väldigt glad att vara här. So thanks for being here and staying until the end. So I'll try to make my talk quick and useful. I'm going to talk about three things. One, the state of things outside of healthcare system that affect healthcare and the state of healthcare system, and then how digital technologies can change or make the healthcare system more efficient and more effective. But first, there is a quiz. So this is probably the easiest quiz you've ever seen. Anyone disagrees that C is not the wrong answer? So most people would say C is wrong, and it's because we are so used to doing arithmetic in base 10. Anything outside of that seems wrong. So C is the right answer if you're using base 12 addition. So a lot of changing things in a complex system is about looking at things from a different perspective. So the solutions you hear, things you maybe heard today, if they appear far off, if they appear wrong, they may not necessarily be wrong. They may be just a different way of thinking. And before I get into things we need to improve on, the good thing is that we will all live longer. The lifespan continues to get better. And I'm sorry I wasn't here earlier today, but you may have seen this slide before. It's a commonly cited thing that lifespan is getting longer and longer for humans in all parts of the world. So now I'm going to talk about food. That's a big part of how health, especially in the US, obesity is a big user of healthcare or healthcare services. The disease is caused by obesity. But there is so much conflict in what you read, and because we don't have enough time or intensity or know-how of knowing what is right. So you look at, you read salt is bad for you. But then you see Japan, people live long time there. This is a picture of the woman who lived up till she was 117. And with a rich salt diet, they somehow survive much longer than average. Then we hear alcohol is bad for you. Yesterday, I was at the reception. I saw some of you were drinking alcohol, and you're doing fine today. So it's not so bad, and that's until a couple of years ago, the cops in France could drink wine or beer during lunch, but nowadays they can't, but the performance hasn't improved. Then, sugar is bad for you. We hear that a lot. That's a picture of Warren Buffett. He's one of either the richest or one of the richest men in the world. He's 85 now, and he eats, does anyone know what peanut brittle is? Okay, he eats peanut brittle every day, drinks Coke, and I was at the last shareholder meeting where he speaks. Someone asked him about his sugar intake. He said, I'm 25% Coke. He drinks so much Coke. And he mentioned that if he has to eat broccoli every day, he would have died by now. So a lot of it is about, who you are, and, well, I'll get into that. But is sugar bad for you? Then we have, at least in the US, these food fads. Quinoa. Has anyone heard of quinoa? Yeah, so quinoa used to be big. The new thing in the valley is kale. Everything's about kale now. And you can take it with salt, that's kale chips. You can take it with sugar, there's kale ice cream, or you can take it with alcohol, that's kale margarita. Then everyone's happy to drink it. So the reason I showed you this is a lot of things you hear in conferences, in school, in classes, things are taught or talked about in generalities. But generality is not always universality. So you have to see how it applies to your context, what you're trying to do with that information. Then we go into human behavior. So there are a few traits we have. We like to eat. Yeah, we like to try different things. We like to drink. The key is moderation. Yeah, even in moderation, sugar, salt, alcohol, they're all fine. It all depends how you feel about these things when you eat them. But so one trait of human behavior is we like to eat and drink. Second, we don't like being stressed. So most of the stress, if you read the literature, and I worked in an organization where we found out like 90+% of stress is caused by love or work. So it's relationships and money. So how we pick our job, people we spend time with, relationships, you have to see, is it causing stress? But people don't like stress, but we do get stressed, how society is today. And then third is we like to watch TV. And that's most people, not all of them, but most people don't like to think. So George Bernard Shaw was a famous playwright. He said he has made an international fortune by thinking twice a week, when most people think twice a year. So TV is a form of entertainment where you don't have to think. It's more passive entertainment. So given all these things, where you live, these are just few examples how human behavior is. Where you live, where you work, how far you walk, how much TV you watch, what you eat, what you drink. These are all examples of human behavior that affects health. And then I'm going to show you a few examples of how the science is progressing as it relates to outside the healthcare system. And then it goes to the healthcare system. This is the Da Vinci robot. You may have heard of it. It's used in surgery. Then we are close to finding vaccination for Ebola. So all this is really great news. And then this is the what's called female Viagra. So there were complaints that only men have Viagra. So now FDA approved the female Viagra. Then this is MRI is helping us learn more about the brain, how synapses work, the relationship between stress, mind, how we think. And then when we decoded the genome, we thought we'll have, it'll change medicine, but now we are learning about epigenetics. But there has been a lot of progress in science as it relates to the healthcare system. But all that R&D happens outside the system in a way, not in the healthcare environment. And then the message here is it's interconnectedness of all things. We tend to look at things linearly. This is, let's say, just eating, or just surgical robotic surgery, or just the DNA sequencing. But you have to realize how these things are interconnected. Then I get into how technology is changing rapidly, again, outside the healthcare system. And is the advancement in these technologies enabled us. I used to work for a company called National Semiconductor, where we created the first multi-sensor consumer bracelet, a wearable device, before you had Fitbit, Jawbone, etc. So what enabled that was these enabling technologies. So cloud computing. Now, not only storage, but you can have processing in cloud. So I have a new startup that I'm doing, and it's streaming video. We pay less than $100 a month to Amazon. So, and the prices will keep on falling. Then sensors, you may have heard of Internet of Things. So that's all powered by sensors. So pricing of sensors is getting cheaper. Now you have, I don't remember how many sensors iPhone has, but it has a lot of them. The previous one had the pressure sensor, but it's the downfall in pricing that's enabling sensors to be present everywhere. Then you have social networking. So now in specific diseases like diabetes and many others, you have these specific networks which act as support system. Because when you are suffering from something, you want to talk to someone who can understand you, who is going through the same pain. Gaming, so this is extremely helpful in motivating you to do things that you don't want to do. So for example, when we created the device the app that came with the device, you could do games, which I think is getting popularized now by Fitbit in enterprise model. If let's say you and I are friends, and we can decide to compete who walks 10 miles first, or something like that. Then Bluetooth, now we are way ahead. That's, consumes less battery. You can do a lot of things that enables communication between these, sensors or the devices and your phone. So the phone is acting as a hub. So that's mainly because of Bluetooth. And then packaging, that's making things smaller and smaller, so you can package things and make them attractive so you don't look like a patient when you're wearing something. So all these things are happening outside the healthcare system. So now let's look at the healthcare system, where the big problem is the cost. Yeah. Other than that, I would say cost and errors. These are the two main issues in the healthcare system. And in Sweden, the cost is much lower as percentage of GDP. US is around 18+% of GDP spent on healthcare. And Sweden, I think, is less than 10%. So, Sweden is doing better than the US, but I think still there are opportunities for improvement everywhere using digital technologies. And this is actually interesting. This is how healthcare system works in the US. So the dots on the left-hand side, or my left-hand side, they are the patients, and the white circles, the small ones, are doctors. So the brown arrows is the flow of information. So the information goes to the doctor from the patient, and then blue arrows are the care. The care is given to the patient from the doctor, and then the information goes from the doctors to the insurer, and the insurance gives money back to the doctor, and then employer is funding the insurer, and then nowadays, after Obamacare, patients or citizens can have to go directly to insurers if they don't have employer-sponsored insurance. So you see the complexity of the system. Someone's paying, someone's getting information, and Sweden is in a much better place to make change in that system. In the US, there are too many parties involved, or what I would say, too many losers in making a change. But I wanted to give you an idea how, and I kept pharma out of it. That's another, I think we can have an hour talk separately on just how pharma works and how a lot of the R&D comes from public money, and then most of that goes into profit for pharma. Then healthcare devices. So I showed you those enabling technologies. So we have, and it's a good thing that we have these devices, but they're not making the desired change. Most, or at least for Fitbit, public data is available. 50% of people stop using them in a year, and 40% of them stop using them in 3 months. Why is that? It's because our nature is we are lazy, and we have this awareness, but there's no one pushing us. There's no integration with the healthcare system. And if we can make that happen, then you will see the adoption going much higher. Then you have a lot of silos within the healthcare system. So you have, when the patient comes in, he or she has to deal with so many entities, and they don't necessarily talk very well with each other. And the number varies on what the actual count is, from 100,000 to 400,000, on how many deaths could have been prevented. But it's a huge number. These are all preventable errors. And in 2009, as part of the I forget the exact name, bringing the economy back up. High-Tech Act was passed, so 29.5 billion was dedicated to EHR, electronic health records. But it hasn't produced the desired change. Because, again, you look at things in siloed, not realizing interconnectedness thing. So a story I heard, I don't know how true it is. So digitization, people saw as you have patient's information on a sheet of paper. So you scan the paper, that's digital. So when the other doctor needs it, you print it back, and then you take it to the doctor. So, so these things have to be more clearly defined and communicated on the actual use of these things. Then we don't know enough about the mind-body connection. Like, I think stress causes so much change to healthcare, but we don't know that we don't know a lot of things. So, for example, you must have heard of dark energy. So that's 72% of the universe is made of dark energy. 24% of the universe is made of dark matter. So that's almost 96%. We don't know much about these things. Everything we know is within the atomic world, that's 4%. And consciousness, I would say, one of the biggest problems in science, we don't know what it is, or we have some general idea, but that's a big question. Once we understand that, we may be able to find how interconnectedness between mind and body works. Currently, you have theories. If there's no concrete answer. Yeah, but I think that's an area that should be heavily investigated. And I think the main cause of these high costs in the US is pay for service. So, meaning you get paid regardless of how the service is performed. Let's say you go to a doctor, they do something, you don't really know if they did a good service or not. So generally, people don't have a good idea of the requirements or how long it takes to get better, or how disease should be diagnosed and treated. It's just too complex. And everyone has a busy life. So I think pay for service is causing a lot of this rise in cost. So 5% of patients in the US cause 50% of cost. I was shocked when I heard that number. And 30% of that occurs in the, and I don't remember the exact statistic, but 30% of the healthcare expense comes from the last 1 year of life for older people. So then what do we do about it? So I talked about things that affect healthcare outside the system, how the healthcare system is, and now what do we do about it? So that's where the digital technologies can help us tremendously. One is, like any organization you see, so you look at the free market economy. I mean, there's a lot of competition in that. What competition is there in healthcare? Like you go to a hospital, you don't really choose. Within a hospital, there isn't much competition. And centralized planning, that's another way of looking at managing large, complex systems, but that we know doesn't work as well. The fall of USSR and all previous centralized planning doesn't work. So what do we do? So I think a good way is to create competition like we have in sports teams, where you can have one group of doctors versus another group of doctors competing with each other based on how they diagnose things, how fast they treat, how long it takes for a patient to get better, who does it at lower cost. So if you create competition within the hospital, then you will see huge change in behavior of the people who work at these places. And then you measure progress. So all that won't be possible without digitizing things. So digital will be enabler of creating this competition within the hospital. Then the current system is designed for cure. Like you go to the doctor when you're sick. So the whole idea is it's designed for cure. So you go there to get better. And then it's event-based diagnostics, meaning, let's say I have something wrong today. I go to the doctor, they check my vitals and how I am that way today. But if you turn things around, make the system more prevention-oriented, and that's only possible if you connect, the personal wellness data you generate from these devices to the healthcare system, then you can have this continuous stream of data about me. So maybe I'm that way every Thursday. So you're not just looking at an event, you're looking at the continuity. And then let's say you have data from all 10 million or 9-something million people from Sweden, anonymized. You can do predictive analysis, all this big data we hear about, that can be really useful here. And if we make that connection, and you have cloud, you have big data analysis, so the enabling technologies are there. So now we need to see the courage of the policymakers, the courage of doctors to connect these things. And once you have that, you can create technology as an assistant to doctors or to caregivers. So for example, if you have all my data all the time, my heart rate, blood pressure, my body temperature, etc., then you can do telemedicine, you can avoid patients going back to the doctor or going to the doctor, you can do a video chat, or, the basic stuff, if you think about, when you go to the doctor for, cold, flu, etc., it's like a decision tree. So you have this symptom plus this symptom plus this symptom equals this plus this equals this. So a lot of these tasks can be well accomplished by algorithms. So if you can use software for some of these things, and it's being tried and tested in Africa these days using, training people with some education using mobile phone as kind of a doctor or first step. But you can't really replace a doctor, human judgment, but you can add on to it with intelligent software. So if you have that, then you can make a change on how we do care. So at the point of entry, you can decide, this is emergency because you have all the data. This is something that can be treated with telemedicine. This requires special team. This requires physical, or not physical, the primary care physician. So at the point of entry, you can make these changes. So that's a much more effective system of handling this wide variety of tasks a healthcare system has to do. But to get there, you need these connection of personal health with the healthcare system. Then a lot of it is, communication. So when you register for, let's say, any new website or create a new username password, you have to do it twice. You have to write your password twice so you don't forget. And when you're prescribing medicine, does any doctor write it twice? There's so many errors because of wrong prescription. So the communication has to improve drastically, not only within doctor and other people in the healthcare system, but also doctor, physician, doctor, old people. I forget the name. The care facilities for the older people. And incentives. So if you change the incentives on how people inside the healthcare system are compensated or who gets credit, that will have a huge impact on the system. So these are a few things that digital technologies enable, can change the healthcare system. But the most important you can do as patient or as people to be healthy is do things that make you happy. if you're happy all the time, chances of you falling sick are low. Thank you very much.
Boom.
Thank you for that full circle integration of the health system. I know we're running out of time, but please, do you have any questions, comments?
Yeah,
Shoot.
absolutely. One of the things, because we know that you're advising the Swedish government, which is great. We've also heard during this conference that Sweden might be the place for really integrating digital health into the government, into legislation, all of that. So what are you advising?
I was, not anymore. And it was Region Skåne, that's where I worked with the regional government. So I think Sweden has one centralized healthcare system, so you can make these changes better than the US. So you have, the regional, the county, but it's still more centralized than the US. You have expertise in radio technologies. The smartphone came out of here, from Sweden. The first smartphone was invented here. So Bluetooth was invented here. So there's expertise in radio technologies, which is essential for these sensors to talk to some kind of hub. And then there's a history of medical innovation in Sweden, and I know more about the Lund University innovations. So they created the first artificial kidney, the first portable ultrasound. So there's a list of the medical innovations in Sweden. And it's more, there's need for economic growth. I think you can combine these two things, have changing the healthcare system and economic growth.
Scalability.
Yes, a small question regarding health system. You talk about that we, as Sweden, or the established system, that we could perform a change. But if you look at the mobile systems or the networks, we are seeing that the emerging markets like Indonesia, Thailand, and so on are leapfrogging us when it comes to implementation of new technology, new ways of doing things. Do you still believe that we, the old nations like the US and Europe, will be able to change faster than the emerging markets?
It all depends on the will and the courage of politicians. So the technologies, how things are implemented in Africa, they don't have the best technology. Mobile banking is still done through SMS. And the healthcare is they're using old Android phones. So the problem is interoperability. So we have a system in the US, you have a system here. Anything new we do has to work with that system. So that's the challenge, how we make the interoperability. So maybe we try something completely different and then find a way, show the possibility, and then find a way to integrate it back into the system.
Hi, it's Henrik. I had a question regarding the link actually to Thomas Ottala, because he was talking about the patient being a customer, and I like that. I think it's really the right way to look at everyone is a customer. We have a choice. However, at least in the Swedish system, it's very hard for us as consumers of healthcare to actually be able to rate or identify the doctor, because typically we go to the nearby primary physician, and then he recommends or she recommends us to some other doctor. But there's no real way, as far as has been spread. We heard yesterday that there are systems in place to grade and to identify it. But how do you see that part of it, of the transparency process inside the healthcare? Because I can choose between Coke and Pepsi and XL Cola, but I really can't choose between doctors A, B, and C.
Yeah, you're absolutely right. And we are not educated enough to find out if you got a good service or not. So let's say I go to a doctor, he or she does whatever they do. How do I know it was a good service? Am I going to get that disease again, try another doctor? No. So it's tough when these surveys are done. It comes down to how nice the doctor is. If he or she is talking to you nicely, then that's how people think, yeah, he or she must be good. So it's not that doctors shouldn't talk nicely. Everyone should talk nicely. But it's hard for people to judge if they got good service. So in that scenario, that's why I mentioned we need to create competition within the hospital, not like a market economy where you go from one shop around for doctors. I mean, you don't, when you're sick, you want to see what's closest to you and what's available.
But then again, I also think that the patients are getting more knowledgeable, and with the digital technique, they're able to do research and so forth. So that could be one aspect.
I think we all agree here that we need to involve the patients much more and have a much better interchange of information and power between the patient and the doctor. But how do we do that? The current system is not built on that. What do you think would be the best first step to create through patient empowerment?
Patient engagement.
Yeah, well, one is when you go and see a doctor, you question them. Like the mindset I grew up in India, there you never questioned your doctor or your teacher. And then now I live in the US, you question your teacher, but you still don't question your doctor. So you question your doctor, why did you come to that conclusion? What are the other options? And then I can say you can read up, internet is full of things, but then you will see salt is good for you and salt is bad for you. So it's really hard to find out the reality of what works for you. So the best thing would be integrating these vitals with the healthcare system. But that's longer term. I think it'll take time. But initially, when you starting today, what you can do is when you see the doctor, ask them questions. Tell them, ask them to explain.
As a patient, you maybe have to take more control of your health and also educate yourself more.
Yeah.
Okay, I think we have to do a little wrap up. Okay, well, thank you for your questions. Thank you so much for that insight. Best of luck. And